Now guys, moving on to the next topic, lungs. Now we are going to move towards the most important aspect, that is tracheobronchial tree. So we all know that the trachea begins from here in the neck region, and then it is going to descend down into the mediastinum, and there the trachea will actually bifurcate or divide into the bronchus. So first you'll be having the primary bronchus, and then the secondary bronchus, and further we'll be actually having the tertiary bronchus. That is the reason why I gave the name of this heading as tracheobronchial tree here, sir. Trachea and the bronchus and the tracheobronchial tree. Now followed by that, once you have a clear idea regarding this entire concept of tracheobronchial tree, then followed by that we are going to learn about the root of the lung and arrangement of the structures inside the root of the lung. And if you study in this manner, the things will become very much easier to learn all the structures arranged in the root of the lung. Perfect. So now let's get started first with the tracheobronchial tree here, guys. Now to begin with, first of all, imagine this one here to be your trachea here, and this trachea is actually moving down here, and the trachea will actually bifurcate into the right primary bronchus, and then there will be a left primary bronchus here, guys, the right and the left primary bronchus. And if this is your trachea here, the trachea will actually have those C-shaped cartilaginous rings in that one. Now one thing I would like you all to appreciate here in the diagram, to focus on one thing in the diagram here, guys. This will be the right primary bronchus here, and this one here will be the left primary bronchus. And please look at the way how exactly I have bifurcated that. It's not like bifurcating exactly in the middle there. It's not bifurcating exactly in the middle, and right and left primary bronchus are not exactly the same. If you observe in the diagram very carefully, the right primary bronchus will be more wider in diameter, and not only wider in diameter, is like more vertical also. It is more vertical, guys, and it is actually shorter in length. It's shorter in length, whereas left primary bronchus will be more longer in length, whereas it will be shorter in length, and that is very much important for the clinical aspect. Fine. Why? Because of this reason, what is going to happen, because the right primary bronchus is more wider, shorter in length and more vertical, so most of the things which are going to go inside or in the trachea, most of the time the infections are prone more towards the right lung, guys, more towards the right lung. Okay, so let us write down these three important properties of right primary bronchus. So the right primary bronchus, number one, remember it is more wider in diameter. Number two, remember it is shorter in length. It is not very long when compared to the left one, and it is more vertical. It is even more vertical also. That is about the right primary bronchus, guys. Now what is going to happen, this primary bronchus is the one which will enter into the lung, and obviously the right primary bronchus will enter into the right lung, and the left primary bronchus will enter into left lung. So let's do one thing here. Let us try to incorporate our lungs over here. So this one here will be your right lung, and this one here will be the left lung here, guys. And in the left lung, I hope you all know that very well right from first year MBBS days. The left lung will be actually having a notch, and that notch is actually to accommodate the heart there. That is why it is actually referred to as the cardiac notch. And just above the cardiac notch, there will be a tongue-like structure known as lingula. We are like well aware about all those things. We don't have to worry about that. Now out of the two bronchi, that is the right primary and left primary, first let me teach you about the left primary bronchus. Why? Because it is little bit easier also, and it goes according to our common sense. So the left primary bronchus will actually enter inside the lung, and the moment it enters into the lung here, the left primary bronchus will be dividing into two secondary bronchi. So that's your left primary bronchus, and the primary bronchus will be dividing into, obviously according to the name indicates there, it will be dividing into a secondary here and another secondary bronchus over here. Now guys, recall in your mind, like left lung will have how many lobes in that? The left lung will actually have like two lobes. There will be one upper lobe, another one is a lower lobe. So out of these two secondary bronchus, remember one of the secondary will be supplying to upper lobe and another secondary will be supplying to the lower lobe over here. So therefore, let us do one thing here. Let us just write down the names of this bronchi also simultaneously. Be careful, guys. I am not speaking about the bronchioles right now. That is totally a different story. I am speaking about bronchus. So first of all, you actually have the primary bronchus. And primary bronchus, you can very clearly see in my diagram, it is the main one, it is the chief one which is actually supplying to the entire lung. The right primary bronchus supplying to the entire right lung, left primary bronchus supplying to the entire left lung. That is the reason why, because it is the chief one, the main one, it is also known as the principal bronchus. So the primary bronchus, it is also referred to as the principal bronchus, the main one supplying to the lung, entire lung. Whereas now we have seen that the secondary bronchus is the one which will be actually supplying to what? The lobe. That is the reason why it is known as the lobar bronchus. Lobar bronchus. So one of the secondaries supplying to the upper lobe, another secondary supplying to the lower lobe, that is why lobar bronchus. Now as the name indicates over here, the secondary bronchus will be further dividing into the tertiary bronchus. secondary is further dividing into the tertiary bronchus. And remember, my dear friends, this is the thing which most of the students will not be knowing, that tertiary bronchus is the one which is further actually supplying to the segments present inside. Have a clarity here. I have seen certain students getting confused between lobes and segments there. Lobes are different and segments are different, guys. Okay. So therefore, remember, tertiary bronchus will be the one supplying to segment. That is why it is known as the segmental bronchus. So try to make it very simple in your mind from today onwards. You just try to imagine like this, guys. There is a lung. Inside the lung, you are actually having the lobe, and inside the lobes, actually you are having the segments. And the lung will be supplied by primary bronchus, lobe will be supplied by secondary bronchus, and the segments will be supplied by tertiary bronchus. So make it very simple. I repeat again: lung, lobe, and segment, primary, secondary, and tertiary. Crystal clear concept. That's all. Now, once you are done with this on the left side, I mean to say the left lung, now let us move towards the right side, towards the right lung. Now, let us try to understand towards the right what is the important thing. Now, before moving towards the right lung, I would like to introduce the heart in the middle. So, let us include the heart in the middle here, and I am not going to draw like exact diagram of that one, so just a schematic diagram. For example, if this one is your heart over here, we all know our heart is divided into 4 chambers here, and out of the 4 chambers, this one here will be the right ventricle. Now, if that is your right ventricle over there, remember from there what is going to begin? Pulmonary trunk. Okay, and the pulmonary trunk will actually come out and divide into the right pulmonary artery and the left pulmonary artery. Guys, I am telling you again and again, it is not at all the exact diagram of the heart. It is not the way how the pulmonary trunk will be present over there. It is just for the sake of our understanding here. Otherwise, in the topic of heart, I have already told you in detail about the pulmonary trunk, the pulmonary artery and all. But focus on the important thing that we have to learn right now. On the right side, what is happening? Now, as a simple medical student, what I am thinking here is that, the right primary bronchus has to enter into the right lung and then divide. Like what I am thinking right now is that right primary bronchus has to enter inside the lung and then divide into secondary. But it is not at all happening like that towards the right side. Now, towards the right side, what is happening is the right primary bronchus is dividing just before entering into the lung itself. Oh my God. It's dividing just before entering into the lung. And on to that, second important point here is that one of the bronchus will be above the artery, another bronchus is like below the artery. Now, sir, what the hell are you telling here? I'll tell you everything in detail in the diagram here, guys. Welcome. The right primary bronchus will be dividing just before entering into the lung, and that too it is dividing in such a way that one of the bronchus will be present above the pulmonary artery and another bronchus will be present below the pulmonary artery. Appreciate that 2 points very, very clearly in my diagram here. That's the reason why doctors have given a beautiful name here, very simple name here. The bronchus above is known as the eparterial bronchus. The bronchus present above is known as the eparterial bronchus, and the bronchus present below here will be known as the hyparterial bronchus here. And look at that beautiful name, guys, eparterial. Ep is epi, above the artery. Hyparterial, hype is below the artery. So, eparterial and hyparterial bronchus, guys. Okay, so let us just write down the full name here. E stands for arterial bronchus, and then H here stands for hyparterial bronchus. I think now you will 110% agree with me how the concept is becoming like crystal clear here. I have seen like many students just mugging that name without understanding eparterial, hyparterial. It's because of that pulmonary artery there. So, because of the pulmonary artery, one is above the artery, eparterial bronchus, one is below the artery, that is why it is hyparterial bronchus. That is some important thing which I wanted to put in your mind in the right lung side, sir. Now, after that, they are going to enter inside the lung, and right lung, we all know it will be actually having how many lobes? There will be like 3 lobes, upper lobe, the middle lobe and the lower lobe. Now, out of these two, remember, eparterial one is the one which will just continue, and it will continue to become your secondary. And I told you very, very clearly, guys, secondary bronchus is the one which will be supplying to the lobe. It is a lobar bronchus. So, secondary will be supplying to the upper lobe. And whereas the hyparterial bronchus is the one which will be dividing into 2 secondary, and those 2 secondary will be supplying to the, one out of the 2 secondary, one of the secondary will be supplying to the middle lobe, and another secondary is the one which will be supplying to the lower lobe. So, understanding? It's a beautiful thing. So, I repeat again, eparterial bronchus will just continue to form secondary supplying to the upper lobe, whereas hyparterial will in turn divide again to divide into 2 secondary. Out of that, one of the secondary will be supplying to middle lobe, another secondary bronchus will be supplying to lower lobe, guys. And after this, it is easy. This secondary will be further dividing into tertiary bronchus. This is also dividing into tertiary bronchus, and this one will also divide into tertiary bronchus, and they are further going to supply to the segment. They are segmental bronchus. And if you now look at this entire picture here, that's the reason why I gave the name to this entire thing here as tracheobronchial tree. It's a beautiful trachea and dividing into the primary bronchus, then the secondary and tertiary bronchus over there in a crystal clear manner. I hope the concept is very much clear. Now, after completing this entire thing, guys, I would like to ask you one important controversial question here. Let us write down here. One of the controversial question, let us clarify that one here. Yes, trachea bifurcates, bifurcation of trachea. Trachea bifurcates at a dash location, guys, whether it is at T4 or T5 or T6 or T7, where exactly the trachea will bifurcate. If a question is given like this, then your answer has to be T6, guys. Trachea bifurcates at the level of T6. That's the answer that you have to give. Now, let me do one thing. Let me just modify this question a little bit over here. Trachea bifurcates at dash in cadaver. If this word is given, that is cadaver word is given, cadaveric bifurcation of trachea, then your answer has to be like T4 here, sir. So, you have to just look into the question, don't confuse yourself. In the question, if the word is given as cadaver, cadaveric bifurcation of trachea will be at the level of T4. If that word cadaver is not given over there, then please mark the answer as T6. It is clearly, very clearly mentioned in Gray's anatomy, guys. Okay. So, trachea bifurcates normally at T6, but when it is given as cadaveric bifurcation, mark the answer as T4. That's something important. I just wanted to mention here. Why? Because we are speaking about the trachea and the bifurcation of trachea into the bronchus. Perfect. And one more thing I would like you people to add here. The primary bronchus is the one which will be supplying to the lung. The secondary bronchus is the one which will be supplying to the lobes, and tertiary bronchus is the one which will be supplying to the segments present inside the lobes. So, primary, secondary, tertiary, the lung, lobes and the segment, guys. Perfectly done. Almost everything here is perfectly done. And now, once you are very clear about all this tracheobronchial tree, let us now move towards the root of the lung. Now, what is the root of the lung and how are the structures arranged inside the root of the lung? And to make you understand that, first of all, let me do one thing. Let me show you exactly what is the root of the lung first of all, and then slowly we will move towards the arrangement of the structures. Let us not jump to the topic directly and give you certain mnemonics and all. Okay, let's do it conceptually, guys. So, to make you understand that, first of all, try to draw the diagram of the lung in 3D here. So, that is the mediastinal surface of the lung, and this here will be the diaphragmatic surface of the lung, and then the costal surface, guys. Let us write down the names here. This is the mediastinal surface of lung. That is towards the mediastinum, guys. Perfect. And this one here will be the costal surface of the lung towards the ribs. And finally, this one here below will be the inferior surface of the lung, or else we can also call it as diaphragmatic surface. Inferior or diaphragmatic surface of lung. So, the mediastinal surface, the costal surface and the inferior or diaphragmatic surface of the lung, guys. Perfect. Now, on the mediastinal surface of the lung, you actually have an opening here through which all the structures will enter the lung and leave the lung. Okay, on the mediastinal surface, there will be one opening there through which all the structures will enter the lung and leave the lung, and this opening here is referred to as hilum of the lung. It is known as hilum. And all the structures which are actually entering and leaving the lung from here together, they are going to form a tube-like structure. So, from this hilum, whatever structures are going to enter and leave here, like your pulmonary artery, the bronchial artery, the bronchial, pulmonary veins and all those things which are going to enter and leave the lung, together they are going to form a tube-like structure there, and that tube-like structure is actually referred to as root of the lung. This itself is actually known as the root of the lung here, guys. I hope you are getting the clarity between the hilum and the root of the lung. So, the opening there is known as the hilum, whereas all the structures together they are going to form a tube-like structure that is known as the root of the lung. And in your exams, they are actually asking you about the arrangement of the structures inside this root of the lung, that too above downwards and then anterior posterior. So, from above downwards and from anterior towards the posterior, how the structures are arranged, we need to understand that. But before making you write down that and before making you draw the diagram, guys, the most important thing here is orientation. If you don't understand that orientation, then you will never be able to understand how the structures are arranged actually. So, we will do one thing, better we will do one thing. This diagram I think you have seen like thousands and thousands of time in your life. Now, this diagram of the lung, that is the mediastinal surface and the root of the lung especially there, I think you have seen like many times in your life. Now, let me give you a proper orientation first, and then later on we will actually draw this diagram also. So, look at me and look at this diagram on the screen there simultaneously, guys. Look here, right lung and the left lung. This will be the mediastinal surface of the right lung over here, and this will be the mediastinal surface of left lung. Let me just keep my hand here. Mediastinal surface of right lung and mediastinal surface of left lung. Now, if this is the mediastinal surface, I am able to see one opening here, and that is the hilum of the lung here, and I am able to see one opening over here, that is the hilum of this lung here, hilum. And then from here, all the structures are entering and leaving the lung, and together they are going to form a tube-like structure, root of the right lung, and this will be the root of the left lung over here. So this will be the root of the right lung and root of the left lung. Now, you got to learn the structures arranged inside this root above downwards and then anterior-posterior, above downwards and anterior-posterior here, guys. But there is a problem. The problem here is that root of the right lung, root of the left lung, they are something like this here. And if you are looking me from the front, then you are unable to see inside this roots here. You are not able to see inside the root. So if you are not able to see inside the root, then how can you learn? To make you learn the arrangement of all those structures, these two roots, I am going to turn it towards you now. So let me turn these roots towards you right now, sir, like in this manner. The root of the right lung and the root of the left lung, we are turning like this. And now the moment you see inside, easily above downwards here and then above downwards here. That is not at all a problem. The problem is, the moment I turn, some of the students are getting, distracted. They are unable to understand the orientation. After turning, they are telling this one is lateral and medial. Be careful there. It's not lateral and medial. Yes, this is anterior. So even after turning, anterior and posterior, anterior posterior. And here also after turning, this is anterior posterior. All this hard work here I am doing for you to make you understand this orientation only, anterior posterior. That is the problematic for many students, guys. And this beautiful picture on the screen over here is exactly the same thing. Both the roots turn towards you like this here. Both the roots are turned towards you like this here. Okay. So let me just write down in this diagram here itself, guys. This is actually anterior here and this side is actually the posterior one here. And we got to learn anterior posterior. Of course, this is the right lung over here. And in this one, this is anterior over here and this will be the posterior aspect over here. And we got to learn the arrangement of the structures anterior posteriorly, of course in the left lung. Hope you are getting the clarity now about the roots. Orientation. First, orientation is important and then later on you actually study about the arrangement of the structures, guys. So now what we'll do here is, we are not going to like draw the entire diagram of the lungs over here. It will become like more complicated. So in this entire diagram, let me just only take out this roots here. So this will be the root of the right lung over here. And this one here will be the root of the left lung. So we are not going to draw the entire diagram of the lung here. We are just going to draw the root of the right lung and left lung. So please write on the heading there as root of lungs. Now imagine this one here to be the root of the right lung here, guys. And this one here to be the root of the left lung. So this will be the root of the right lung over here. And this will be the root of the left lung. And before moving ahead itself, I'll give you the orientation. This is like anterior. And this will be the posterior, and we have to learn the arrangement of the structures anterior posterior. And similarly here also in the left lung, this is anterior aspect here and this is the posterior, and we got to learn the arrangement of the structures anterior posterior here. Perfect. Now this is the diagram present in your textbooks, anatomy textbooks and all, and that's the reason why most of the students are getting confused. They are thinking it is like lateral and medial. It's not lateral and medial, it's anterior posterior. Now once you are comfortable with this orientation, let us now see the structures, and again we'll do the same thing. First we'll see in the left one, a bit easier, then we'll see the root of the right lung. In the root of the left lung, first of all, above you'll be actually having the pulmonary artery here, sir. There will be pulmonary artery entering into the lung. Now you might be getting confused here, sir is telling pulmonary artery but he is drawing in blue color. Yes, pulmonary artery is the one which is going to carry deoxygenated blood. That is the reason why I am drawing in blue color only. Perfect. And then just below this you'll be able to find bronchus entering into that one. And bronchus will be entering into the lung more posteriorly, behind. Posteriorly, bronchus will be entering inside. And then finally below here, you'll be actually having the veins, guys. The pulmonary veins, of course, there will be two of them. There will be two pulmonary veins. Perfectly done. Now, let us see towards the right lung first of all, the arrangement of the structures, then we'll start writing the notes. In the right lung also, again what you have here, you'll be actually having the pulmonary artery here, guys. Perfect, no problem with that one. But just few minutes before, I taught you about the tracheobronchial tree. That is for this reason only. On the right side, try to recall what's happening. On the right side, right primary bronchus will be dividing. Before entering into the lung, it is dividing. And it is dividing in such a way that one of the bronchus is above the artery, another bronchus is below the artery. So you'll be actually having the eparterial bronchus here, and then below the artery you'll actually have the hyparterial bronchus, eparterial and hyparterial bronchus. And then we don't have to worry about the veins. Veins are present below only here, and there will be two pulmonary veins over here, guys. Perfect. And don't get confused again there, why sir is drawing like pulmonary veins in the red color. Pulmonary veins are the one which are going to carry oxygenated blood. That's the reason why we are drawing in red color over there, guys. Perfect. Now, once you are perfect with this diagram here, practice this diagram 2 or 3 times. After that, writing the notes is not at all a problem. Writing the arrangement is not at all a problem, guys. It's all about image based conceptual anatomy. Image is important. Now, after that, let us first of all see in the left lung. In the root of the left lung, how are the structures arranged? Above downwards. Above downwards. And now do one thing, just look at the diagram and keep on writing. What do you have above there? First, you will be actually having the pulmonary artery, and just below the pulmonary artery there will be bronchus, and below the bronchus you actually have the pulmonary vein. So, it is like artery, bronchus and vein arranged above downwards. Artery, bronchus and vein arranged above downwards. Now, similarly, let us write what are the structures arranged above downwards in the root of the right lung. So, in the root of the right lung, how are the structures arranged above downwards? Now, here you got to be like really alert here, guys. Look at that right lung. First of all, above, superiorly, you will be actually having eparterial bronchus there. That is, E stands for eparterial bronchus. And the name itself is telling you it is above the artery. So, then therefore, the next one will be pulmonary artery. And below the pulmonary artery, you actually have got hyparterial bronchus. That is hyparterial bronchus. And then finally, you have got the pulmonary vein. And that is how all the structures are arranged above downwards in the root of the right lung. And my dear friends, look at that list now. If you just look at that list right now, on like in the root of the right lung and left lung, the structures are arranged in a different manner. That's the reason why in the exams this topic is creating a lot of confusion, and that is why it is hot favorite of your examiners. Your examiners are like trying to confuse you. Achha, by the way, how will they ask you the question here, sir? How will they ask you the question in this topic? Yes, they're like, which of the following structure will be the superior most structure in the root of the right lung? They'll give you like 4 options. So, which of the structure is superior most in the root of the right lung? Root of the right lung, superior most will be eparterial bronchus, uppermost one. Similarly, which of the following structure is the inferior most in the root of the left lung? Inferior most will be always the vein, pulmonary vein. So, in this way they will ask you, or otherwise nowadays INI CET exam, they have started with the latest trend questions, and in those questions they are even asking you about the sequential arrangement of the structures. So, they might give you all the structures and arranged in the sequence of above downwards. So, these kind of questions are possible in this topic, and you got to be very careful. It's like not directly jumping into the root of the lung and studying. Try to make a proper concept starting from tracheobronchial tree. Perfect. Now, once you are done with this one, the last and final thing is how are the structures arranged antero-posteriorly, and that is very much easier, guys. Why I am telling you? Again, let's go towards the left lung first. In the left lung, if you observe carefully, anteriorly you will be having vein, pulmonary veins, and just behind the pulmonary veins you will be actually having artery, and then behind that you will be actually having bronchus. Bronchus, I told you, it will be entering into the lung more posteriorly. So, vein, artery and bronchus. Similarly, towards the right lung now. In the root of the right lung, first you will be actually having vein, and then again there will be artery, and again there will be bronchus. Oh my God. Thank God, finally something is easy here. Antero-posterior arrangement in both the roots is same only. It's like vein, artery and bronchus, and vein, artery and bronchus in both the lungs, root of both the lungs. So, let us just write it here and finish it off. So, when you are going from anterior towards the posterior, the arrangement of the structures will be first there will be vein, and then followed by artery, and then followed by bronchus. And thank God we do not have to learn it separately in the root of the right lung and left lung. It is the same for both of them. It is vein, artery and bronchus. That is the best way to learn here. The arrangement above downwards and then antero-posteriorly. Now, after completing all these things here, some of the students will be worried about, sir, why is this additional space left here? And what is the name of that one? Is there any specific name of this one? First of all, my dear friends, learn the name here. This is actually known as the pulmonary ligament. That is pulmonary ligament here. It is nothing but the modification of visceral pleura only. What is the pleura that is actually covering the lungs or adherent to the lungs, the inner one? That is visceral pleura only. That visceral pleura is actually reflecting there. And you can see this additional part here which is referred to as the pulmonary ligament only. Fine. We are now comfortable with the name, sir. That is known as pulmonary ligament. But what is the use of this one? That is providing additional space, additional dead space for pulmonary veins which are inferior most there. So, sometimes what will happen, the pulmonary veins will dilate whenever there is increased venous return and all. So, what is going to happen? The pulmonary veins will dilate, and when they are dilating, it requires some additional dead space, and that is provided by the pulmonary ligament. Come on, even this thing is also clarified now. Now, after completing this entire topic in a very conceptual manner, starting from tracheobronchial tree, telling you all the arrangement of all these structures in a very conceptual manner, one last thing I want to complete here in this topic is, yes, some people might be like mnemonic lovers, and they want to learn in the mnemonic way manner. I'll just give you one small mnemonic here, how to remember. Like above downwards, there is one old mnemonic here, that is the name of our respected ex-Prime Minister, that is Atal Bihari Vajpayee. So, above downwards, first you will be having artery, and then you will be having bronchus, and then you will be actually having the vein. Atal Bihari Vajpayee, artery, bronchus and vein. Artery, bronchus and vein, above downwards. That is one way of remembering. I'll tell you like one more way of remembering here. I want to give like everything possible for you people, and you are mature enough to follow whatever you want. Anterior posteriorly, it's like vein, artery and bronchus. When you are going anterior towards the posterior, it is vein, artery and bronchus. And above downwards, it is artery, bronchus and vein. And some people love to remember like this also, VAB, ABV, VAB and ABV. So, I told you like every way possible, the conceptual manner, the mnemonic manner, memorizing, mugging up, every way possible I told you. And now it depends on you which method you like, you select that and study in that manner. But you have to remember this topic, it is utmost important. Root of the lungs has been asked many times in the exams, guys. Perfect. Now, one more thing which has been recently tested in the exams is, if you just observe this diagram more carefully, let me just remove all this from here. If you observe this diagram like more carefully here, guys, this will be the root of the right lung over here, and this is the root of the left lung over here. And just above the root of the right lung, are you able to appreciate one depression over here? And similarly, above the root of the left lung also, are you able to appreciate one depression, or we can say the impression over there? Yes. They have already asked in the exam, what is that impression representing? Remember, above the root of the right lung, there will be the impression of arch of azygos. When we studied about the intercostal veins, I taught you the entire azygos venous system, azygos vein, hemiazygos vein, accessory hemiazygos vein and all. And we have learned azygos, the meaning itself is unpaired, it is single. And if it is single, it is present only towards the right side. And that's how, try to take it like a hint and remember, azygos vein, it's unpaired, single and present towards the right, and it's moving up, moving up, moving up and arching above the root of the right lung, arching above the root of the right lung. And left side, I think I don't even have to teach you what it is going to arch around the root of the left lung, and that will be definitely the arch of aorta, guys, towards the left side. So, let us just make a note of even that one also in a separate diagram, guys. I don't want to clutter the diagram. So, imagine this is the root of the right lung over here, and this one here will be the root of the left lung, and above the root of the right lung there will be arch of azygos, arch of azygos. And similarly, above the root of the left lung, you will be able to appreciate like one more arch over here, and that will be arch of aorta, arch of aorta. A small thing, but very much important, has been tested in the exam, guys. And by this, we finish everything regarding the root of the lung in a very conceptual manner. Thank you, done.